Hey, hi everyone. Welcoming all of you all back to the next episode in this series. Friends, in this particular video, me, your host, Dr. Moez Kakiani from Mumbai, India, I will be talking to all of you all about the burrs that are used for tooth preparation, specifically a kit that has been designed by me under the banner of MIK Dental. Friends, in this video, I'm going to be talking to all of you all about the advanced crown, bridge and Vineyard preparation kit, which is a system for tooth preparation. Friends, before I go into the depths of helping you understand my thought process behind this kit, let me bring attention to the fact that in the last decade or so, there has been a tremendous advancement in the materials that are available to us for the different prostheses that we fabricate for our patients. Friends, although material sciences has developed so quickly over the last few years, the burrs or the drills that we use to prepare a tooth have unfortunately not kept pace with this. Friends, a lot of burrs that we use for tooth preparation were designed at a time when gold-based restorations were in vogue. At that time, friends, porcelain fused to metal was also gold-based. Complete metal crowns were gold-based. Nickel chrome, cobalt chrome were not used then. Zirconia most definitely wasn't available. Emax was not a restorative material available then. Which means the burrs that were designed then, to a great extent, can actually not be used correctly as of today, for the simple fact that the dimensions and the designs are not ideally suited. Having said this, friends, I have gone through the laborious task of designing a system that contains 19 different burrs. Each tip design is unique in itself. The concept behind all of this was, one of the biggest concerns that a lot of clinicians I know have is, doc, I'm not sure which burr am I supposed to be using for the different prosthetic materials that are available. I get confused between which burr do I choose, how do I choose, how do I use that particular burr. The other concern that a lot of my participants and fellow colleagues, especially those who are fresh graduates, tend to have is, doc, how often should I be using the same burr? When should I be disposing? When should I be replacing? What are the different grids for the burrs that I should be using? To take care of all of these situations and scenarios, what I did is design this kit, and I allowed for the kit to speak to you. Presenting to all of your friends the base of the advanced burr kit. The base, as you can see, is divided into 7 different clusters. Each cluster is specific to either a prosthetic material or is specific to the role of that particular burr in terms of the tooth surface that it is used for preparation. Let us look at these individually before we actually go into the understanding of each of these burrs from a clinical perspective. Friends, let us first pay attention to the first cluster that you see here. It says this is for PFM margins, which means whenever you are preparing a tooth for a PFM, one of these 4 burrs in sequence is what is used to prepare the margin. On the other hand, if you are preparing a metal free, you will choose the 2 burrs that are present in the cluster number 2. Now, if you look closely, each burr is also labeled with a unique code. The very first burr there is an MS 1.0. Now, what does MS essentially stand for? MS stands for modified shoulder, which means if you use this burr, you automatically develop at the margin a modified shoulder architecture. What does 1.0 stand for? Friends, 1.0 stands for the diameter of the burr at the tip. The tip, as we all know, is the functional area of the burr, which means if I were to sink this burr full depth into the tooth, I know I have created a 1 millimeter groove there. The second burr that you see on its immediate left is the DC 1.0. Now the DC essentially, friends, the letters stand for deep chamfer, which means when you use this burr, it will give you a deep chamfer margin. Here again 1.0 stands for the diameter of the burr at the tip. We all know that the DC burr is supposed to be used half depth, which means when I sink this burr half depth, it gives me 0.5 of a millimeters, which is essentially what a metal lingual collar requires. The two other burrs in this cluster, the third and the fourth burr, essentially have an F that is written against the name. The F essentially, friends, stands for finishing diamond. So this burr, the third burr that you see, is MS 1.3F, which means this is a modified shoulder burr, tip diameter 1.3, and it's a finishing burr, which means this is a red ring burr. The previous two burrs are blue ring burrs. Blue ring is essentially something that is used for regular tooth preparation. F, which is a finishing diamond, is used to go ahead and finish and smoothen the preparation after the gross reduction is complete. The fourth burr is the DC 1.2F burr. I'm sure you guys now understand. DC stands for deep chamfer, 1.2 is the tip diameter, and F stands for finishing. So each of these burrs has been coded for you to recognize the margin architecture and for you to appreciate the diameter of the burr at the tip, thereby allowing for you to quantify the amount of margin preparation that you achieve. The second cluster, which is for metal free, essentially has two burrs, friends. The first is the DC 1.4. It's a deep chamfer burr, 1.4 millimeters tip diameter. When I sink the burr half depth, it automatically gives me 0.7 of a millimeter preparation. The next burr is a finishing burr, which is 1.8 millimeters in tip diameter. When we look at the second row, the very first cluster is called as modified interdental. The MI series has two different tip diameters, 0.8 and 0.5 millimeters. What was my thought process when I was designing the modified interdental burr? Friends, how often does it happen that when preparing the proximal aspect of the tooth, you inevitably land up hurting the interdental papilla? As we move from the buccal towards the lingual, we all know that the interdental papilla is saddle shaped, it's a cone. Alright, so when we're moving from the buccal through the palatal, we land up going slightly subgingival on the proximal interdental aspect. The papilla gets hurt and now there's bleeding. This makes impression making difficult. I'm sure we would have all experienced this patient where we've prepared the tooth and for some reason not given a provisional, and when the patient comes in for the next appointment, you can actually not see the margin at all. What has happened here? The interdental papilla that was traumatized proliferated. As it proliferated, it kind of grew onto the margin and completely obscured that margin from view. A lot of times, what do we do in such a situation? We still go ahead and place the prosthesis. What this does is it squeezes the papilla. The papilla essentially does not like that. What does it do? Over a period of time, the papilla recedes. What now happens is a small little triangular gap opens up, and a few weeks or a few months later, the patient comes back saying, "Doc, I am now getting food lodgement between the teeth," when everything to begin with was correct. How do you essentially take care of this problem, friends? With the help of a modified interdental burr. What is my concept for a modified interdental? This is a regular taper fissure burr. It's just that the tip of the burr is non-cutting, which means the tip has absolutely no diamonds, which means when you run the burr from the buccal through into the lingual, you cannot go subgingival, you cannot go apical at all, which means you no longer will hurt the interdental papilla. A small little change that will go a long way in making sure that food lodgement related problems now don't trouble you as much. Friends, the second cluster in the middle row is the occlusal reduction burr. These are OR 1.6 and OR 1.2. These are essentially straight burrs, and these are 1.6 millimeters and 1.2 millimeters in diameter. 1.6 is something that is used for functional areas in a PFM. The 1.2 is something that is used on the non-functional for PFMs and is used for all metal-free restorations. The next one is cingulum reduction. This is called CR and it is 2.3 and 2.8 millimeters at its widest diameter. The 2.8 millimeter, which is the wider of the two, is used when preparing the lingual fossa for wider teeth like maxillary central incisors and maxillary canines, whilst the 2.3, which is slightly smaller than it, is used for all the other anterior teeth, all the lower anteriors and the maxillary lateral incisors, which we know are smaller in dimension. Friends, the next cluster, which is the only cluster in row 3, is titled allied burrs. The first burr in this is called as the EC 1.4 burr. EC essentially stands for end cutting burr. So this is, friends, a burr which has diamonds only and only at the tip. And appreciate the fact that it is a finishing diamond. So this is a diamond burr that is used to take the margin of your preparation equigingival, especially on the proximal areas, without the fear of the burr hurting the adjacent tooth. Now let's appreciate the fact that because this burr has absolutely no diamonds on its side, even if my burr shank goes and physically contacts the adjacent tooth, I'm not concerned of the fact that my adjacent tooth will be traumatized. The next burr in the kit is an IR burr. This stands for incisal reduction burr and it's a 2 millimeter burr. So the length of the functional tip is 2 millimeters, and when I use it in the manner that I will explain later, you will essentially ensure predictability at reduction of 2 millimeters at the incisal edge, not less, not more. The next burr in the kit, friends, is CA 1.6F. CA stands for ceramic or composite adjustment burr. This is a burr, friends, that is supposed to be used when you are doing occlusal adjustments at the bistroyal phase, which means when you put in your articulating papers and you see your high points and interference inclines, it is this particular shape that is to be used to remove those interferences. Here again, it's a finishing diamond because we at no point want to take away the anatomy from the tooth. We simply want to make sure that we remove just about enough amount of porcelain which is interfering. The last burr in this series, friends, is called as the DC 1.0 double S burr. The double S essentially, friends, stands for super short, which means this is an extremely short burr. Where would I use such a short burr? In an area which is difficult to access. Classically, the distal of the maxillary sevens. We all know how difficult it can be to get into that area, especially in patients who have a smaller mouth opening. So a shorter burr allows for greater dexterity in that particular space. The fourth row, the last essential set in this burr, friends, is the Porcelain Laminate Vineyard series. It has 3 different burrs. The PLV 0.3 and the PLV 0.5 burrs are depth gauge burrs. Essentially, these give you 0.3 and 0.5 millimeter depth grooves, thereby allowing for you to gauge the amount of tooth that you have prepared. Whilst the last burr in this kit, friends, is the DC 1.2 EF burr. EF stands for extra fine. This is the only yellow ring burr in the kit. We know for a fact that when we are doing bonded restorations, very close adaptation between the prosthesis and the tooth is ideal, so that the cement space is the thinnest possible. This is the only situation where you will actually polish your preparation with a yellow ring burr. In no other situation would you use the yellow ring. You always finish the preparation with a red ring. The reason why we do so is because, friends, it is important to understand that most common cement that is used today is glass ionomer, and a glass ionomer cement works on the basis of friction between the two surfaces, which is exactly the reason why we sandblast a crown from inside, so that we can increase the surface area and thereby increase the friction. What you want is a smooth tooth which is finished but not an extremely polished tooth. If your tooth has been polished with a yellow ring, the surface is glass-like almost. Such a surface does not provide for friction, and thereby your patient will keep coming back with a displaced prosthesis. So here again, it is important to understand that you always finish the preparation with a red ring. You never polish your preparation with a yellow ring. The entire kit, friends, is autoclavable. For this kit to be used in accordance to the design, it's extremely important that once you use a burr, you put it back into its respective slots, thereby making sure that the next time you use these burrs, you don't interchange them accidentally. The other brilliant thing that MIK Dental has done is they have come up with this kit in 10 different colors. What you see here is a kit which has a grey base inside. Similarly, there are 9 other colors available so that you can match it to the color scheme of your practice or some color that you may actually like. Friends, this is a small little description of the advanced burr kit. As we move forward through the next lecture, I will help you understand how to use these burrs in the correct manner to prepare the different teeth that we have in the oral cavity for various prosthetic materials that are available to us. Thank you.